Hi everyone, I'm Dr. Alexandra Brown. I'm a board-certified dermatologist. If you have acne-prone skin and want a routine that actually works without spending a fortune, then this video is for you. Today I'm going to walk you through a full drugstore skincare routine I often recommend to my patients with breakouts. We're going to go through cleansers, treatments, moisturizers, sunscreen, all derm-approved and easy to find at your local drugstore. So if you're into derm-back skincare advice, make sure you like this video and subscribe to the channel. Let's get into it. Acne-prone skin needs more than just a quick fix. You want a routine that does three things. It's going to keep your pores clear by gently removing excess oil and dead skin cells. It will reduce inflammation that drives breakouts, and it will support your skin barrier so you can tolerate the treatment without irritation. A lot of people make a mistake of over drying or over exfoliating their skin thinking it's going to clear up faster, but harsh products can actually make acne worse by causing inflammation or triggering even more oil production. So the goal here is balance, effective ingredients at the right strengths paired with gentle support. So let's get into the actual product recommendations. Let's talk about cleansers first. We all have to wash our face, and this is the easiest place to introduce some of the active ingredients. You want something that's going to remove the oil and impurities but not really dry you out too much. So say no to those cleansers that have beads in them. Mechanical exfoliation is just not the thing that you need if you want healthy skin. When it comes to active ingredients over the counter, you're going to find two main active ingredients in the acne aisle when it comes to cleansers. First one's benzoyl peroxide, and it's the go-to treating acne. And second one is salicylic acid. It works so well at clearing out those pores. So let me give you a recommendation in each category. My first recommendation here is the CeraVe Acne Foaming Cream Cleanser with 4% benzoyl peroxide. This also comes in 10% benzoyl peroxide, and I like the 10% for the back, but I really like the 4% as introduction, as face acne. This is a gentle yet effective fighting cleanser with 4% BPO, which is lower than your traditional 10%, but it's still effective. So if you have sensitive skin, this is perfect place to start. It has this really creamy texture that helps reduce the dryness and irritation, making it a great option for those new to benzoyl peroxide or those using other active ingredients in their routine. It's really good for those red, inflamed breakouts like papules and pustules, especially for people with combination or sensitive skin. My next recommendation in this cleanser category is the La Roche-Posay Effaclar Acne Face Cleanser. This one has the other active ingredient, which is the salicylic acid. It's a gel-based cleanser formulated with 2% salicylic to help exfoliate inside the pore and reduce blackheads, whiteheads, and clogged pores. It lathers really well, rinses clean, and it helps reduce excess oil without over drying. It's a really great pick for morning or evening in your acne routine. It's really best for that comedonal acne, meaning the blackheads, the whiteheads, or like bumpy skin texture. It's also ideal for those with oily or acne prone or maybe even combination skin that need pore clearing without irritation. I would not go for salicylic acid cleanser if I was treating acne and I have dry skin. The key ingredients here are the salicylic acid, the glycerin, lipohydroxy acid, also known as LHA. It's a derivative of salicylic acid and has a little bit of exfoliating and skin renewing properties. You washed your face, now we gotta moisturize. Let me give you some recommendations because even acne prone skin does need a moisturizer. A damaged skin barrier is going to make your acne worse and not better. So let me give you a couple of recommendations that you can use after you wash your face. My first recommendation is the Vanicream Daily Facial Moisturizer. It's one of the simplest, most barrier-friendly moisturizers you can find out there. It's completely fragrance-free, lightweight, non-comedogenic. It's ideal if your skin feels dry, tight, irritated from the treatments. It's really good for acne prone skin, really any skin type, dry all the way to sensitive, even combination to oily. The best time to apply moisturizer is immediately after washing your face on damp skin. The key ingredients here are ceramides, hyaluronic acid, and squalene. My next moisturizer recommendation is the Cetaphil Gentle Clear Mattifying Acne Moisturizers. This is super lightweight, non-comedogenic moisturizer specifically formulated for the acne prone skin, specifically if you're oily. It helps control that oil and shine while providing hydration and barrier support. It's completely fragrance-free and has this matte finish, making it really good for daytime use, under makeup, or underneath the sunscreen. It's best for oily, acne-prone skin looking for that shine control and hydration at the same time. But it's really also good for anyone who's using active treatments like salicylic acid and benzoyl peroxide and needs a lightweight barrier support. The key ingredients are salicylic acid, 0.5%, prebiotic aloe, panthenol or vitamin B5, and niacinamide. And my last recommendation in the moisturizer care category is the Panoxyl PM Balancing Repair Moisturizer with niacinamide. You really want to use this one just in the evenings. It's really lightweight, balancing like this gel cream moisturizer that delivers instant, continuous hydration while helping control oil production, calming the look of redness, and minimizing appearance of pores. It's specifically formulated for that acne-prone skin, and it helps control oil production and minimize the look of pores. It has a little bit of niacinamide, which will help control excess oil and visibly even out the skin tone. It would also help balance moisture levels overnight. It's not greasy. It does not clog your pores. The key ingredients are niacinamide, ceramides, hyaluronic acid, and cica. My next recommendation, and this one's so important, you're going to think I'm crazy, but it's SPF. Sunscreen is non-negotiable, you guys. Acne treatments make your skin more sensitive to the sun, and skipping sunscreen is going to worsen those acne dark spots anyway. So say it with me, SPF every single morning. If you want more SPF recommendations, I'm going to give you a couple of SPF recommendations here, but if you want more extensive drugstore SPF, I'm going to link up my drugstore SPF video down here. Make sure you check it out for more SPF options in case the two that I mentioned here are not your jam. All right, my first recommendation is the Eucerin Oil Control SPF 50. This is super lightweight, oil-free sunscreen. It's designed specifically for oily and acne-prone skin. It gives you that full broad spectrum UVA, UVB protection with a matte finish that actually holds up throughout the day. It uses antioxidant and oil absorbing technologies to prevent shine and support skin exposed to environmental stressors. It's really best for that acne prone oily skin that gets shiny midday. It's also ideal if you want high SPF protection without clogging pores or needing any touch-ups every few hours. This is a chemical sunscreen. It contains avobenzone, homosalate, octisalate, and octacrylene. It also has L-carnitine, which helps reduce excess sebum production, and silica, which will absorb some of that surface oil and sweat for a long-lasting matte finish. My next SPF recommendation, and I recommend this one to I'd say 90% of my acne patients, is the CeraVe Facial Moisturizing Lotion AM SPF 30. This is a 2-in-1 daily moisturizer and sunscreen that will hydrate the skin while offering that broad spectrum sun protection. It's lightweight, non-comedogenic, completely fragrance-free, making it ideal for daily use even if your skin is sensitive or acne prone. The finish is really natural. It's not overly matte, not too dewy, not greasy. It's just right, and I find that it layers really well under makeup. It's really best for normal to combination acne prone skin looking for a really easy morning step that's going to give you hydration and SPF in one. It also makes a great barrier repair for people on actives like retinoids or salicylic acid. The key ingredients are ceramides, niacinamide, hyaluronic acid, and then for sunscreen ingredients, it has zinc oxide, homosalate, and octinoxate. I'm going to be honest with you, those three right there are your basics, but let's get into a little more of like treatments, serums, exfoliants. If you want to get fancy, let's talk about what you actually need to add to treat your acne now. The key here is going to be not to layer everything in one. So if I'm mentioning actives, you want to pick one or two, use them at night, make sure you're using them at the right time of the day. Some ingredients work best at night, others work better in the morning and underneath your SPF. So let's get into the active ingredients that are actually treating your acne besides the ones I mentioned in the cleansers. The first one here is the GOAT. It's adapalene 0.1% gel. The brand name here is Differin Gel. Differin is a type of a retinoid that helps prevent clogged pores. It calms down inflammation. It will also help fade some of those post-acne dark spots over time. It works deep in the skin to treat and prevent breakouts. It can also increase sun sensitivity, which is why it's always important to use this at night and wear your SPF every single morning. I love adapalene for any type of acne, any persistent breakouts, hormonal acne, comedonal if you just have clogged pores. Any type of acne needs adapalene gel. I may even go as far as to say that acne is adapalene deficiency. I'm kidding on that one, but everyone needs adapalene if you have acne. The best time to use it is at nighttime after cleaning your skin and before moisturizing. So wash your face, dry completely, take a pea-sized amount of Differin Gel, dot it, spread it, avoiding the eyes, and then let it dry completely, then apply your moisturizer on top. Do this 2 to 3 nights a week for a few weeks. Make sure your skin is not dry, peely, irritated, and then if you're tolerating it okay, go ahead and increase it. Because I guarantee you, if you put this Differin Gel and like slather it all over your face every single night, odds are in a week you're going to say you're allergic to it, and you're not. You're just developing normal side effects, and in order to minimize those side effects, you really need to do either the sandwich method or just the adapalene gel with the moisturizer on top and increase gradually and not go straight to every single night. Of note, once upon a time, adapalene 0.1% gel was prescription, and now it's over the counter. The highest concentration of a retinoid that does not require prescription, and it's available over the counter. Retinoids help regulate cell turnover to prevent clogged pores, and that is the best best way to treat your acne. And my next recommendation that I mention in clinic for my acne patients, like 99% of the time, are the pimple patches. The one I'm going to mention here is the Hero Mighty patch, either original or the invisible one. You can use these anytime, morning, evening. I've gone to meetings with them on my face. It's no big deal. These are hydrocolloid patches. They're a really good tool for protecting and treating active pimples, especially whiteheads. They absorb fluid, they reduce picking. This is really important because picking increases scarring, and they create like this clean, healing environment for your acne. The Invisible Plus version can even be worn during the day under makeup. These are best for any sort of early stage pimples or if you're somebody who likes to pick. If you look at what we've talked about so far, that is really all you need to effectively treat acne. You need to give it 2 to 3 months. Be consistent. Now, if you're somebody who's like, well, I need some serums, I need more actives, let's get into those, but let me make it very clear, serums are not needed. They can be an added benefit. So if you're somebody who's already doing everything we talked about so far and you're not clear, or your skin is really oily and you want to add serums, then this part of the video is for you. But if you're somebody with dry, sensitive skin and you haven't even done any of the points up to this point, you can probably skip this part. My first recommendation for the serums is the Ordinary Salicylic Acid 2% solution. You can use this AM or PM. The Ordinary can be found in most drugstores. Now, it might Target. I don't think we have it. Personally, I'm in a small town in Southwest Virginia, so we really only have it at Ulta, but it's very, very affordable. I've bought several of their things. Like, I got a giant jug of glycolic acid for like $10. These are very affordable. Now, the salicylic acid serum is the lightweight serum, exfoliates inside the pores to keep them clear. It helps reduce blackheads, whiteheads, and oily shine. Because it doesn't increase sun sensitivity as much as the retinoids, it can be used morning and night. It is best for clogged pores, blackheads, or that texture skin. I wouldn't start doing this morning and evening because adding salicylic acid twice a day right off the bat can be very drying to your skin. I would probably personally only add this in the evening on the nights I'm alternating with the adapalene gel initially. So if you're starting your adapalene gel 2-3 nights a week, the other 4 to 5 nights a week, I would use the salicylic acid serum. The key ingredient here is the 2% salicylic acid, which clears pores, helps prevent breakouts, but also minimizes oil. And when you're minimizing oil, you can cause dryness. Side effect of adapalene gel is also dryness. So do not start those two at the same time. The serum also contains a little bit of niacinamide, which will help reduce some of the inflammation and support the skin barrier, as well as panthenol and sodium PCA, which hydrate and calm the skin. My next serum recommendation is the La Roche-Posay Effaclar serum. This is a super lightweight salicylic acid acne treatment serum that clears blemishes and helps prevent new breakouts while also visibly reducing pores, fine lines, and post-acne marks. And when I say reducing pores, I mean the pores appear smaller. Anything with the active ingredient of salicylic acid will probably have a claim that it may reduce your pores. What it does is it decreases the oil in the pores, decreases shine, and pores appear smaller. They're not actually smaller. The key ingredients in this one are salicylic acid 1.5%, the glycolic acid, lipohydroxy acid, niacinamide, and La Roche-Posay thermal spring water. This serum can be used morning or evening. I would not start with both because it can be very drying. My next recommendation is for those girlies who want anti-aging effects, but they also want to treat your acne. And yes, it is a vitamin C. This is La Roche-Posay Vitamin C10 serum. If you are somebody with acne-prone skin and you want to use vitamin C serum, this is a great one because it has those anti-aging benefits of vitamin C and antioxidants, which increase potency of your sunscreen, but also helps with post-acne marks and active breakouts. It's a super lightweight, fast-absorbing serum with 10% pure vitamin C. It gently refines skin texture and brightens without being greasy. It also contains a little bit of salicylic acid for that mild exfoliation, and it does smell really nice. I do like a little scent in my skincare from time to time. The key ingredients here are 12% L-ascorbic acid, salicylic acid, and neurosensine. If you're somebody who's tried this one, or maybe it's not your jam because it's pretty potent, it's 12% L-ascorbic acid, or you just want a vitamin C that's different from this one, I'm also going to link a video on vitamin C's for different skin types to check out others. That's it, y'all. That's your full dermatologist approved drugstore skincare routine for acne prone skin. Remember, the goal isn't to do it all at once. You want to start simple. Pick one cleanser, one moisturizer, get you adapalene gel, and make sure you have SPF every single morning, and go from there. Consistency and patience are so much more important than the number of products you put on your skin. If you're using any actives like retinoids or sal acids and serums, always use SPF every single morning, and never layer multiple actives at the same time, especially when first starting. If you're one of my patients and I had you watch this video just to kind of remind you on how to use all your topicals, I'm glad you made it this far. Let me know below if you have any comments or questions. And remember, skincare takes time. If you start that different gel and you use it every single all night, you're not going to get better results. If anything, you might just experience some dryness, peeling, and irritation. Back off, moisturize on top, and try it 2-3 nights a week. Build up to every night. Don't give up. Let me know in the comments if you've tried any of these or if you have any others that are your drugstore favorites for your acne-prone skin. I love learning new ones. Also, let me know if there are any other skin types or concerns that you want me to build a skincare routine for next. Don't forget to follow me on Instagram and TikTok at Dr. Alexandra Brown. As always, thank you so much for watching and supporting me in this journey. If you found this video helpful, make sure you like it and subscribe to my channel for more derm-approved skincare tips. Thank you so much for watching. I'll see you next time.